Hello and welcome to the Queen Elizabeth Patient Podcast. We're today at the Proto Building. My name's Caroline Tweedy. I'm one of the Macmillan Personalised Care team members, and we're here today with Emma Golightly, and she's here to tell us a little bit about breast screening. With it being October and Breast Awareness Month, I think it's quite a good conversation to have. Yes. So, Emma, tell us a little bit about breast screening, or ask a little bit about you and how did you get into this role?
So I am a health improvement practitioner. I work across not just breast screening, but I work across bowel screening and the AAA screening programme, which is abdominal aortic aneurysm. I got into this by accident, really. Saw the job, I applied, came into it. Wasn't working in the NHS before, backgrounds in local government, where I was managing kind of the health teams. And so this is my first job within the NHS.
And I take it that you're enjoying it?
Well, it's been a bit different over the last year, yes. But other than that, yes.
Yeah. So breast screening, obviously Gateshead is one of our breast screening hubs. So can you tell us a little bit about the breast screening programme and its aims?
Well, I mean, a lot of people already know about the breast screening programme because it has been going on a while. Basically, it's a female-only screening service, and we basically aiming to bring women in to get them screened to detect if there's any signs of cancer. And as I say, the Gateshead screening programme covers kind of Sunderland, Durham, Chelsea Street, South Tyneside and Gateshead itself.
So it's quite a large population, isn't it, that we're covering?
It is, yeah. A lot of the screening programmes cover more than one kind of locality, so it is quite a large locality.
Obviously, breast screening is vital and it's really important because it does ultimately save a lot of lives. Yeah. So how common is breast cancer?
Well, breast cancer is actually the most common cancer in the UK, and we have approximately 55,000 new cases being diagnosed every year, so the numbers are really high. Although men can get breast cancer, it is much more prevalent in women, and the new statistics are saying that it's around 1 in every 7 women in the UK will be diagnosed with breast cancer at some point in their lifetime. Obviously, if breast cancer is detected early, then treatment's more likely to be successful and the chances of survival are higher. We also know that you're less likely to need a mastectomy, which is where the breast's removed, or chemotherapy if breast cancer is detected early. So really, early detection is key.
So what exactly is the breast screening looking for?
Well, breast screening is looking for small changes in the breast that could signify the presence of cancer. A mammogram is able to see these signs before any kind of symptoms or signs appear that you'd be able to notice yourself. Therefore, attending regular breast screening is really effective in detecting breast cancer early. They do say that current evidence has suggested that breast cancer screening reduces the number of deaths from breast cancer by approximately 1,300 a year.
A lot, isn't it?
It is when you put it like that. So it's that to me, I suppose, it demonstrates why it's really important for women to come along and attend their breast screening, because as I say, getting it early could really change the outcome.
So who's eligible, or when would a woman expect to get an appointment for a screening?
So as we said before, it's a female-only screening programme, and that's because it is more prevalent in women. All women in England are offered breast screening between the ages of 50 and 71 years of age. So all women within this range who are registered with the NHS GP are automatically invited. Therefore, it's really important that your GP has your up-to-date details, so your current address, your date of birth, because if they're not correct, then you might not get your invitation. You'll receive your first invitation between the ages of 50 and 53, and then you'll be invited every 3 years from then on, and that's up until your 71st birthday. Now, women over the age of 71 are no longer invited into the programme, but they can still be screened. It's really important that they know they can still come for screening. They just won't get their invitation. What they need to do is just give us a ring at the breast screening unit and say that they want to still be screened, and we'll give them an appointment every 3 years.
That's great. So I think for a lot of ladies, especially for the first screen, they might be apprehensive about coming for the appointment because they might be unsure of what exactly happens. Can you just tell us what they would expect when they come to that appointment?
Yeah, I mean, the thing to say, I think, really is, first of all, that all the mammographers are female. I think a lot of women are really put off and are a bit nervous about that, but actually all the staff, all the mammographers that you'll see on the day are all female. So we're women who are looking after, the women, we want to, the well-being of women. So when you arrive, the female mammographer will take you to a private room where you'll be asked a few questions about your health. Those questions are just things like, if you're taking HRT, if you're on any anticoagulant drugs, if you have any breast cancer symptoms, things like that. From there, you'll be shown into a private changing room and you'll be asked to remove your clothes from above the waist. For that reason, we would say, we would recommend that women don't wear dresses and things like that on the day, but if you wear kind of like top and trousers or top and skirt, it's a bit easier. And also, we also say, if you want to bring a cardigan or something to go across your shoulders, because we don't actually give you a gown on the day. So from this private change room, when you're ready, you'll be shown straight into the X-ray room, and you won't be expected to kind of walk through corridors or walk along the department. The X-ray room leads straight off the changing room, so it's just open the door and you're straight in there. So please don't worry about kind of having to walk around anywhere. You won't be. So when you're in the X-ray room, you'll see the equipment used to take the mammogram, and you'll be given a chance to ask any questions about the test. For the test, the female mammographer will put you in the correct position, so they do kind of adjust you a little bit. It is, a physical exam, and from the mammogram, the breasts will be x-rayed one at a time. Each breast will be placed on the x-ray machine, and it's kind of like two plates, I suppose, so it will compress the breast, but it is, it's gentle. We try and be as gentle as possible, but it does have to be firmly compressed to take the images, and a couple of images of each breast will be taken. Some women do find this a bit uncomfortable, some women don't. It really just depends. But that's all it is. Once the test's complete, the mammographer will show you back to the changing room, you can get dressed, and then you're free to leave.
And then obviously it's the wait. How long would a woman expect to wait for the results of this?
Your results are normally posted out within a couple of weeks. So normally within 2 to 3 weeks, you should get your results through the post by letter.
And then obviously it is a nervous time waiting for that letter to come through. So what happens if something shows up on that mammogram?
Right. I mean, there's 3 possible options, and as you say, it's a horrible wait, having to wait for it. But the thing to remember is most women are absolutely fine. There's 3 possible outcomes. The first is that it's a normal result, and this means that the mammogram hasn't found anything, nothing of concern, and you're just invited back in 3 years' time. And that's what 95.5% of women who come through screening, that's what will happen with them. There is something that we call a technical repeat, and that's where something's gone wrong with the images are maybe blurred or something like that, and you might have to come in and get the x-rays repeated. It's nothing to be concerned about. And then obviously, there is the situation where something has shown up, and around 5 in every 100 women screened will be called back for further assessment. So that assessment clinic would take place at the Queen Elizabeth Hospital, Gateshead. And you come back in, you'll see a consultant, and you'll have some further tests if necessary. So these tests could include things like you could have the mammogram again, you'll have a breast examination, breast ultrasound, which is painless and quite quick and easy. There are things like, you can have a core biopsy, which is where just a small sample of the tissue is taken, but there will be a local anaesthetic used and the area will be numbed first. And then we have something called a vacuum-assisted core biopsy, where a larger sample of the tissue is taken. But again, local anaesthetic will be used and the area will be numbed first. The good thing about it is that most of the test results are available on the day. So before you leave the clinic, you will see the consultant who will discuss this with you. But if you have a core biopsy, you'll probably be invited back to see the consultant, usually within a week. And we know that this is, as you said before, it's a nervous wait for the letter. But if you get that letter through and you have to come back, I can't imagine what it's like. It must be really stressful. But we really must stress that the majority of women who do get called back, it doesn't necessarily mean you've got cancer. It means something's being detected, but it could be a whole host of things. So please, I know it's easier said than done, but please try not to worry at that stage, because most of the women who get called back, it's not actually cancer.
And I think you've already said it before, that if we do get something and it does turn out to be a cancer, then say the prognosis is generally better. We generally find it at a smaller and earlier rate than maybe somebody who's found a lump.
Yes, because a lot of women, if cancers are detected, they haven't spotted anything themselves. That it hasn't get to the stage where there is a noticeable lump or noticeable change in the breast tissue or one of the other symptoms. It's normally something that is gone undetected, which is normally at an early stage and as you've just said, is more easily treatable.
So what should you do if you do have any symptoms?
Well, the thing with breast screening is, and we really need to get this across, that breast screening is for It's a population-wide screening programme for apparently healthy women. So it's women who aren't having signs and symptoms. That's what breast screening's for. It's to catch those early signs and symptoms. If you have any symptoms or if you notice any changes in your breast, please, what we would say is do not wait for your screening appointment. Even if your screening appointment's coming up in the next few weeks, don't wait. That's not the best course of action. The best thing to do is if you notice any changes in your breasts, go and speak to your GP and they'll refer you down the right route. So you'll go to a symptomatic clinic and it'll be dealt with there. So as I say, if you notice any of these signs, so things like a change in size or shape of your breast, a change in the skin texture, so can things like puckering or dimpling, something like orange peel effect, it can be very slight, a lump or a thickening that feels different from the rest of the breast tissue, redness or rash on the skin or around the nipple. If your nipple suddenly becomes inverted, which means pulled in and it's not normally like that, or it changes its position or shape, a swelling in your armpit or around your collarbone, discharge from one or both of your nipples, or any constant pain in your breast or your armpit. If you have any of those signs or symptoms, please go to your GP and get checked out.
What would you say to women who are nervous or worried about attending the breast screening appointment? Because I think that's probably one of the main reasons that maybe some ladies don't turn up. But I think we're programmed to be worried about the unknown. Yes. So, what would you advise those ladies?
I think you're right. I think the main reason there's a couple of reasons why people don't attend, but it's normally all around worry or fear. So one of them, we know that a lot of women are really anxious about attending breast screen because they feel embarrassed. And I just want to reassure women that all the mammographers in the unit are female, as I've already said, and all of our staff are health professionals. They're not concerned with your size or your shape or what you look like without your clothes on. Their main concern is your health, and it really is. They screen hundreds of women every month. They see all sizes and shapes. They see all different types of bodies, shapes, and they're not focused on that. They don't even notice it. They're focused on getting the best images and making sure that you're comfortable. So please, if it's around embarrassment, please, I know it's easier for me to say that, but don't be embarrassed about coming in. You won't be the only woman that's embarrassed, but you certainly won't be the only woman that they've seen that day. So, don't let that put you off.
And I think you mentioned as well that, you can wear a cardigan over your shoulders. Yes, I think sometimes it's that walk from the door to the actual mammogram machine. But if you feel vulnerable during that time, like you say, the girls are aware of that, and just ask for a coat or a cardigan.
This is what I was going to say. And also, if you are nervous or you are feeling embarrassed, then just say something, don't feel like you have to just do it in silence. Just say to the staff, can I have 5 minutes because I feel really unsure about this, or, and they will reassure you, and, they'll reassure you that there's nothing to be concerned about and just come in. But I know that for some women it is a really tricky situation. And, it's not just embarrassment, but, we hear other things that people have had maybe as a mammogram in the past, which has hurt, or they've heard from other people. And, they've heard reports that it hurts. And some people say, I'm not going for that, And again, all the mammographers are experienced in screening women of all shapes and sizes. So they'll try and do what they can to reduce the discomfort. But, don't let that put you off, because if you found it uncomfortable in the past, it actually doesn't mean you're going to find it uncomfortable the next time round. It can depend on a lot of things. It can depend on where you are in your menstrual cycle. It can depend on how anxious you are on the day. It can depend on the mammography. Everybody has a different technique. So please, and we certainly hear this, when we're talking to women out in the community, and they'll say, no, it was horrible or whatever, I'm not having it done again. Actually, a lot of women don't feel any pain at all. A lot of women will say, it's absolutely fine, I don't know what the fuss is about. So if you are unfortunate to be one of those women who did find it uncomfortable once, don't let that put you off, because next time around it might not cause you any discomfort whatsoever. Completely different. And as I say, the other thing to remember is it only lasts a couple of minutes. So if it is a bit uncomfortable, it's over in seconds. I mean, the actual mammogram itself, where the breast is, compressed within the plates, it's a few seconds really. It's very little, and when you think about that for something that could potentially save your life, then
I think one of the other questions is that sometimes you get is ladies who are very small breasted. It's like, how on earth would that happen? But we do get men, that come with breast complaints, and got a completely different amount of breast tissue to women, but we still manage to get very good views, or even on limited breast tissue.
Yeah, I mean, the mammographers are all professionals. Say they've been doing this for years, and they've seen every different, size and shape of breast. So they know, I mean, I'm not an expert, but they know how to kind of position women and what kind of positions to be in to get the best images and to be able to do the mammogram. And they do, same as, women who will, have larger chests who might be a bit anxious. It's fine, don't worry, there are ways and means of doing it.
Sometimes it's just generally a very anxious time, isn't it? And I can imagine some people are sometimes it's the unknown that, do they really want to know what's going on? Do you get that often as well?
I would say, as well as embarrassment and as well as kind of discomfort, the other issue that people don't come for the screening appointments is that some people just simply don't want to know, or they can't handle knowing. We do speak to women, and we do hear women who'll say, I'd just rather not know. And they'll say things like, if it's my time, it's my time, which I find, it's quite sad, really, because there is things we can do. If it is caught early, there's things we can do. And, unfortunately, breast cancer doesn't stop for fear. So, if you don't come ahead, it doesn't mean that you're, not going to get cancer. It's still going to be there. If you're going to get it, it's going to be there. And wouldn't you rather know early, and therefore you can treat it, and your outcomes are much better than if you didn't? And, a few years ago, when people mentioned breast cancer, it was kind of like, but it's not the death sentence that it was now. We've made huge advances, and, there are a whole host of different treatment options, and more women are surviving breast cancer now than ever before. So detection, really early detection, is really key. So, one final thing I just want to say, please attend your screening appointment. If you're embarrassed, if you put off, if you just don't want to know, then, it's best that you do. It's easy for me to say here, but please attend, because there are things we can do and we'll help as much as we can. So please don't be put off about coming in.
And there is lots of different areas that patients can get more information from. We've got the Gateshead website, which is www.qagateshead, which is all one word, .nhs.uk/breast screening. And you can also contact the breast screening service on 0191 445 2554, or by emailing gan-tr.breast-admin@nhs.net. And you can use this number to change a cancer appointment or book an appointment if you're over 71. Is that correct?
It is correct, yeah. I mean, there's loads of information on there. So, have a look if there's anything else. And if you've got any queries and you can't be answered through there, then just give us a ring. One of our staff will help. I mean, there are some other really good websites out there. Obviously, we've got things like Breast Cancer Now as well, which is just www.breastcancernow.org. They've got loads of information on there. And a really good one that I like at the moment and tell people about is it's called Copperfield, so COPPAFEEL.org, and it's really about that breast check issue. So it's about feeling comfortable about checking your breasts, how to check them, and there is no right or wrong way. Information about you can even get things, little alerts to alert you when it's time to check your breasts and that. So that's another good resource there. But as I say, there's loads of information on the QE website as well, which you've already mentioned. And if people have still got questions, just give us a ring.
Oh, that's great. Oh, thank you so much for coming today, and it's been really informative. So thanks very much.
Thank you very much.